Hi, everyone. Welcome to today's Learning Burst. Our subject for today is infant nutrition. I'm Calliope from last week, and we are joined with the amazing Sharonda Brown and the amazing Dr. April Fogleman, as well as the equally amazing Caroline Hundley. If you could please enter your first, last name, and organization into the chat, that would be fantastic.
And everyone, before we get started, this is our last learning burst for this series of this summer. So this will be 9 that we have done. We have everything up in a folder for you. But I would like to say, in the different transitions that we've had, I know that you've been working with me when it comes to making sure you get those certificates because that is important. And I want you to have those. If you are still missing some from some of the weeks, please send me an email. That way it'll be at the top of my email because I still have a lot of emails to go through from last week. And I will make sure that those are to you. I was able to touch base with 2 emails, one last night that had 3, one today that had 2. If there are any other certificates, any other people that I am missing, please send that to my email and I will make sure that you receive those so that they are placed in your training files in case licensing walks in your door tomorrow, okay? And thank you again for bearing with us during these transitions just to make sure all of these things are taken care of. So with that being said, I'm going to turn everything back over into the hands of Dr. Fogleman.
All right. Hi, everybody. Thank you for being back again this week. I wanted to ask y'all to please let me know if there is a specific question or topic related to infant nutrition that you want me to make sure that I cover. Um, I will try to cover things that I think are relevant to you, but because I don't work in the childcare setting, um, I well, in that capacity, I may not know exactly the questions that you have. So please feel free to ask me those. This presentation is much shorter than last week. So hopefully I will gift you some time today. Um, All right, so just feel free to interrupt me either in the chat or just speak out and let me know what questions you have. Um, but I will go ahead and get started. So last week we talked about breastfeeding, and while infant nutrition is, or breastfeeding is infant nutrition, um, today we're going to talk more specifically about complementary feeding and basically feeding babies food that's not breast milk. And we will talk about breast milk just a little bit today, but not like we did last week. So I know that this is not necessarily relevant to the childcare setting, but um, it is like important to talk about for their first um, their first few days of life. But when infants are born, they have poor vitamin K status at birth. Um, and human milk is low in vitamin K. So the recommendation is that babies receive a vitamin K shot. And then they go through newborn screening at birth that can detect all kinds of different um, disorders before symptoms even occur. So this would let us know if the baby needs to have a special kind of diet, like if they have PKU or galactosemia or something like that. So this newborn screening is mandated for all newborns, and it helps us know if there's something that we like if we need to feed them in a different kind of way. Um, so this right here is not something that you would probably use in your work. But I did want to point it out to you that I don't know, this might be handy. But if you have questions about the energy needs for particular infants, it would be good to ask the pediatrician or a lactation consultant or a dietitian. But these are different equations for calculating the energy needs of an infant. And this can be really helpful in kind of figuring out how much a baby should be eating, and at what age, how much they should be eating. So, depending on their age, you can use this equation and you can put in their weight, in kilograms, and then you can figure out how many calories they should be having per day. Um, this might be helpful, in determining like the period of time that the baby is at daycare, um, how much they should be eating, but it would also depend on how much the baby is being fed at home. Because a lot of times, and I'm not sure if y'all see this, or if the parents talk with y'all about it, but um, moms will sometimes notice that when they return to work and they're separated from their baby during the day, that the baby will start reverse cycling where they eat a lot more at night. And then during the day, they eat less. So I don't know if that is something that y'all have experienced. And then the protein need is down here as well. And um, protein is, for babies, like a little bit, the need for protein is a little bit higher than for adults in regards to their body weight. So like total, it's not higher, but when you compare it to what adults need per kilogram of body weight for infants, it's higher because they are growing so quick. So, okay, now I was just looking in the chat. Okay, wait. Let me get back. All right, so we talked about last week that human milk is breastfeeding is recommended for nearly all infants. There are special cases like we talked about with a newborn screening where it may not be indicated, or in certain situations with HIV, or certain diseases where it might not be indicated. But for most infants, it is indicated for the first 2 years of life at least. And it is included in the Healthy People 2030 goals. And then last week we talked about the 10 steps to successful breastfeeding in the hospital. And here's a link if anyone is interested in that. And then in terms of managing breastfeeding with a mother, not that this is something that you would need to do, but I think it's really important to be aware of these things because definitely practices and support from childcare centers can impact the breastfeeding success. It's not just childcare centers, it's everybody. Like for example, um, when my first daughter was born and she went to the dentist for her first time, she was, I don't know, 14 months or 18 months, something like that. And we took her to her first dentist appointment. And they asked me if she was still nursing. And I said, yeah, she's still nursing. And they said, is she still nursing at night? I said, yes, she does. She nurses a few times at night. And they were getting on to me in a nice way, but telling me that I don't need to breastfeed her at night, or that if I do, I needed to wipe her teeth with a cloth afterwards. Well, that's not happening because at night, if I nursed her, I would go right back to sleep. And I'm not going to wake her up to wipe her teeth with a cloth. So the dental association, like American Dental Association, I think is what it's called, actually is a statement that after 6 months of age, that mothers should not breastfeed their infants at night. And if they do, then they need to, do that where they like brush their couple teeth that they have. So the perspective that they're looking at it from is that they don't want the baby to have cavities. But the perspective that we're looking at it from is that would, if a baby's nursing throughout the night and then they stop, um, and they're not ready to stop, then that would impact the mom's milk supply. Her milk supply would decrease, and then she wouldn't have enough milk to feed her baby. So it's that's just an example of like an organization having good intentions, but it impacting breastfeeding. So, a few things, like there's so much we could talk about, but just to highlight some of the few things. So, oxytocin is a hormone that releases the milk. So it's what causes a tingly sensation in the breast. That's the cells squeezing together and forcing the milk out. And then prolactin, which is a hormone that is driving milk production.
Excuse me,
Um,
April.
yeah.
You have a question, and the question is, should she give the baby a bottle?
Okay, so that's a great question. So in terms of feeding at night to help with preventing cavities, actually breastfeeding directly at the breast is going to be more protective of the baby's teeth than bottle feeding, just um even if it has breast milk in the bottle. The reason why is because with the bottle, the milk can actually pool around the teeth and it might stay there longer. Whereas nursing directly at the breast, if you feel in your mouth with using your tongue, if you can feel the top of your mouth where your hard palate meets your soft palate, I'll give you a second to find that. It's pretty far back. So that's as far as the nipple should be when the mother is breastfeeding her baby. So that's pretty far back. Now, granted, baby's mouth is a lot smaller than ours, so don't get too nervous there. um, but what that tells you is that actually bypasses the teeth altogether. So if you feel how far back that is, as past our teeth. And so it really shouldn't be an issue in terms of cavities anyway. I think it's a misunderstanding with the organization not understanding the anatomy of breastfeeding. They're thinking of it the same as bottle feeding. Um, but with bottle feeding, the milk does tend to pool in the mouth. Um, so with these hormones, oxytocin and prolactin, those can be impacted by certain situations. So oxytocin, for example, that secretion of oxytocin can be impacted by stressful situations. It can be impacted the by being separated from the baby. So oxytocin is that love hormone where um you pet your dog, and there's been studies that have shown that oxytocin is released in the human and the dog. Um, when you hug somebody, if you hug them long enough, oxytocin is released. So, having the baby skin to skin, smelling the baby, snuggling, playing with the baby can all release oxytocin. And, it makes you feel good, it helps you feel happy, but it also helps with that milk ejection reflex. Um, and the reason I'm talking about that so much is because um, when moms are separated from their babies, that release of this hormone oxytocin can really be decreased and make it hard for the mom to provide milk. So really, supporting moms coming in and nursing at childcare centers, or their workplaces or whatever it might be, having them a comfortable place to nurse their baby, should really be encouraged. Um, and then with prolactin, this can be impacted by, like it increases the more the mom nurses, and then it or pumps, and it decreases the less that she nurses or pumps. So frequent nursing and frequent pumping can help stimulate prolactin production, which will increase milk production. So, some tips for breastfeeding for early success: initiate breastfeeding as soon after delivery as possible. Position the baby comfortably and rotate positions. Ensure correct latch and assess for milk transfer. Feeding 8 to 12 times per day during the first few weeks. And then making sure that the baby has appropriate urine and stool output. Um, so I don't know if that's something that people have been asked to kind of track. Is there, the baby's urine and stool output to make sure that it's appropriate during the day. So, this slide kind of, I won't go in detail with it, but it summarizes the different stages of human milk. The important concept with this slide is that human milk is dynamic and it changes based on the stage of lactation. So here's a picture of a mother nursing a baby and a toddler at the same time. And it's neat because the milk does change as the baby grows. So right now, with the mom nursing an infant, it's going to be suited for the infant. But then as the infant grows into a toddler, the composition of the milk is going to be slightly different. It'll still be great. It'll be a little bit higher in protein, actually. And then the milk changes based on the length of gestation. So if babies are born prematurely, that milk is going to be higher in fat, higher in total calories, and it's going to be higher in polyunsaturated fatty acids, which is good for the preterm baby. And based on the time of day, the milk can change composition, and then from the beginning of the feeding to the end of the feeding, and then it can change somewhat based on maternal diet. So, with infant formulas, there are a few different kinds of infant formulas. So, depending on the need of the baby. So, if the baby is not able to be breastfed for a medical reason, or the mom chooses not to breastfeed, then of course formula is indicated. And there's different kinds of formula. So you have to kind of see how the baby tolerates the particular formula, and then choose a formula based on the needs of the baby. There's different types of formula. So there's powdered formula, concentrated liquid formula, and then ready to feed formula. So one important thing to note about mixing the formulas is, um, I'm sure that you all know this. It's one of the things that my students get confused about. So with powdered formula, there is a risk of having bacteria in the formula. So I'm sure that you've all heard multiple times of formula recalls, and that being due to there being some type of bacteria in the formula. Um, so it's important that when we make formula, that the water is boiled. So we boil the water, and my students always get this question wrong on the the quiz. Is that they think that we're boiling the water to clean the water. So if they just use like distilled water or like bottled water or something, that it's fine. But the truth is that we're actually boiling the water in order to kill the bacteria in the formula, if there is bacteria in the formula. Now, chances are the baby will be fine if you don't do this. It really is dependent upon the age of the baby. So for more newborn babies, this is really important because their immune system isn't developed enough. But also, not every can of powdered formula is contaminated with bacteria. We just don't know which cans might be. So the safe practice is to boil the water and then mix it with the formula. Are there any questions so far?
I do not see any more in the chat.
Okay. Okay. Oh, and then ready to feed formula is expensive. So that one is a little harder to have access to for some people. But when there's like a natural disaster that causes power to go out and people don't have power or electricity or anything like that, there's disaster relief organizations that will send formula to those areas. But one thing to consider is that the powder formula, like if those areas have if they are able to boil their water, then that's great. But oftentimes they're not able to, so we really need to send the ready to feed kind of formula. Just kind of a side note. um, okay, so one important topic that I know people ask me about a lot is animal milk in the first year of life. So the American Academy of Pediatrics, they recommend that only breast milk or iron fortified formulas should be given in the first year of life to maintain optimal nutrition status. So we don't want to introduce cow's milk before 1 year of age. Now, I will say I have a mom that asked me this. She was a former patient of mine and she just keeps in touch and asks me questions. Um, but she asked me, like, her baby is 11 and a half months, and she really, really loves cow's milk. Like, she tried a bit, she really liked it, but also, she's not providing enough breast milk. And anyways, I'm like, you know what? 11 and a half months, like, that's pretty close to a year. So I wouldn't really worry about that. Um, but really, early introduction of cow's milk can lead to iron deficiency anemia. This is because it has such a high calcium concentration that if the baby or young child is having cow's milk a lot, then that's going to inhibit iron absorption because calcium and iron, they both compete with each other for absorption. So, if a baby is having milk all day long and they are having all this calcium all day, then they are not going to be able to absorb the appropriate amount of iron that they need to absorb. So, that is one concern. Um, and iron is like the number one nutrient that we're concerned about in infants, and we'll talk more about that in a little bit. It could also lead to some micronutrient deficiencies and dehydration due to the increased renal solute load. And then early introduction of milk does not necessarily lead to an increased risk of cow's milk protein allergy. So here are some important feeding advancement milestones to talk about. And sorry about my slide. I'm not sure why they're different sizes here. But from birth to 4 months, they're breastfeeding or bottle feeding, and during this time, they should be having a coordinated suck, swallow, breathe pattern. Um, and then during this time, they have the rooting reflex and extrusion reflex. That is where the extrusion reflex is where if you try to put something in their mouth, they stick their tongue out to push it out. So that's the extrusion reflex. It's a protective mechanism for them. And then from ages 5 to 7 months is when they start reaching their mouth with their hands. That extrusion reflex disappears. Um, Now, I will say newborns also put their hands in their mouth, okay? And that is a sign of hunger. Like that's a hunger cue. But this is like purposely like grabbing something and then putting it to their mouth. And then between 5 to 7 months is when we start to see good head control and independent sitting. So this is where like you set them down on the floor and they can just sit up on their own and they don't need somebody to make sure that they're steady. Um, the reason why we're talking about these is because this is all very important when it comes to feeding. So, one thing that's very common that I hear a lot, especially we have a free breastfeeding support group that we do every Monday. And whenever the babies reach the age of complementary feeding, this is always a big topic. Is when do we start giving our babies solid foods? Well, pediatricians will often recommend 4 months. They'll say, oh, well, at 4 months, you can start giving them food. They start to be interested and it'll help them sleep longer at night. But last week we talked about why you don't want to use food to help babies sleep longer at night, unless it's that they're truly hungry, but you don't want them to be more full than normal by using food. So that's not a great practice. But one reason why that can be a dangerous recommendation is because um, usually around 4 to 5 months, babies do not have good head control and independent sitting. Now, there are some rare babies who do, okay? So it can happen, but for the most part, um, most babies tend to start sitting independently around 6 to 7 months. Sometimes it can take longer than that. So, um, what we want to do is when babies are being fed complementary foods, we want to make sure that their extrusion reflex has disappeared and that they are able to sit independently because that's going to help protect them from choking. Um, it's also going to, the other thing too, and I mentioned this last week, is that the enzyme that babies need to digest carbohydrates in their gut is not fully developed until they're 6 months old or around 6 months old. So it could cause them upset stomach. Now, like I said, there are going to be some exceptions that there will be some 5 months old that are very interested in food. They're doing all these milestones and they are ready for food. And I've seen that happen and it does happen. But typically 4 months is not really the case. Um, I saw a video one time, sorry, a video one time of a friend. She posted this on social media. This was a long time ago, though, but she was showing how much her baby loved eating baby food. And she had her baby reclined back in a reclined position in like a bouncy seat or something like that. And she was spoon feeding the baby, and the baby would cry after she would spoon feed him and she would keep spoon feeding him. And she interpreted, and I understand why this would happen. Nothing against the mom. This is ingrained in our culture. Um, she interpreted the crying as him wanting more. But when you looked at his body language, he was like turning his head. He wasn't interested in more. He still had the extrusion reflex. He couldn't sit up unassisted. And he was crying because he wasn't ready for the food at that age. So, this is so ingrained in our culture that we really have to be careful about reading the baby's body language and paying attention to these feeding advancement milestones. Around 8 to 10 months, um, baby should definitely be sitting independently. Of course, it's going to be different if there are special issues present. Um, but this is when they have the pincer grasp where they use their fingers to pick things up. And it's really fun to watch, especially like they go to, if you feed them peas, they go and they pick up the peas and then they eat them. Um, or they're like using their hands to feed themselves a lot. And it's really fun, also really messy. But it's a great period of time for them to explore feeding. And then around 10 to 12 months, you have more teeth, or the baby tends to have more teeth. Some babies might not have any by this time, but if not, they're usually getting their first tooth. Um, some babies get their first tooth at 4 months, like my middle daughter. Usually around 6 months and on is when babies are getting more and more teeth. Um, but this helps with their eating skills. Around this time, they have improved biting and chewing skills. They can hold a cup without help. Of course, they might be messy with it if it doesn't have a lid. So I would recommend some kind of lid. Um, so when we are considering complementary feeding, we want to make sure that the food we're feeding meets nutritional needs and prevents deficiencies. So, usually iron is the nutrient that we are most concerned about because human milk is low in iron and um, formula is not that it's not that it's low in iron, like it's iron fortified, so they would maybe be okay if they're having formula. But if they're breastfed, then they definitely around 6 months old, you want to start giving them foods that contain iron. A lot of times the rice cereal that's fortified with iron can be very constipating for them. Um, so sorry, I'm gonna take a sip of water here. Okay. So having food when they're able to, like meatloaf, for example, is going to have heme iron in it, which is easy to absorb. And then the meatloaf is soft enough that they could easily eat that. Um, so thinking like in terms of foods with iron, that would be good. And then making sure it's appropriate for their developmental level. Um, Meeting nutritional needs. Oh, that's repeated. Sorry. And considering what they have an appetite for, a taste for, um, and then also like um, the caregiver being present for that feeding, being interactive with the baby, and then that helps to pique the child's interest. And then priority given to optimizing breastfeeding. So making sure that before 1 year of age, that the baby receives human milk first and then complementary foods. And then after a year old, giving the baby more complementary foods. And then that increasing over time. Um, Making sure that we're using appropriate sanitation. Complementary feeding is one of those times where infections can increase, and that can be due to like not washing hands appropriately or not handling the food appropriately, things like that. And then also being sensitive to the culture of the baby and the family, and you know, having culturally appropriate foods for that baby or foods that are locally available in each community or county. So, some more recommendations. So, introducing complementary foods at 6 months while continuing to breastfeed as long as mutually desired by the mom and the baby. Hopefully until at least 2 years of age, but it's really what's mutually desirable for mom and baby. And then practicing responsive feeding by applying the principles of psychosocial development. So, responsive feeding is when this is kind of funny because sometimes students will say that responsive feeding is when you respond to what the child is saying while they're eating. And while certainly that can be a part of it because we want to interact with the child, um, it's really like what the child is being fed, when they're being fed, how they're being fed, and by whom the child is being fed. So all of these different aspects, like interacting with the child, but responsive feeding is also responding to their cues. So if they're showing you that they're hungry, then feeding them more. If they're showing you that they're full by turning their head away or fussing or pushing the food away, then respecting that they are finished. Um, and then being patient and allowing for the child to explore the food, because that's such a big part of it is exploring the food that they're eating, because it's a new experience. And eating blueberries is going to be different than eating spaghetti. So they're all like different textures, different colors. So it's definitely a time for babies to explore. um, One thing that I'm a big fan of is definitely being interactive with the baby um, and toddler as they're eating. So um, this is important for their development. I had a patient one time who came to see me because her toddler, who was about 14 months old, was not interested in solid foods whatsoever. And it turns out, after talking to this family, that the child never saw their family eat solid foods. So every time that the family ate, so they all worked from home. So they were all home together with the baby. But every time that they had breakfast, lunch, dinner, or snacks, the baby was asleep. So they only ate while the baby was sleeping, which kind of makes sense because then you have a peaceful meal and you're not, wrangling a baby. But then the baby never gets to see them eat. So the simple fix for that, they started having family meal times, and then gradually the child would get more interested in food. So, some more recommendations are to practice good hygiene and proper food handling. So, diarrhea tends to peak with complementary feeding. So, hand washing can help prevent that. So, starting at 6 months of age, increasing the quantity of solid and semi solid foods as the child gets older, while maintaining frequent breastfeeding. So, at 6 months of age, um, that amount of food, of course, it's very dependent on the baby, but usually it's just a tiny bit. It's not like a full meal that you would expect. It's just a little bit. It's really more for practice at that age than anything else. So, as they get older, they will be getting their foods will become more and more solid. And then by a year old, they should really be able to eat anything that you're eating for dinner or lunch. But it might have to be like chopped up in appropriate sizes for them. And then here's some information on preparing homemade baby food. So this is just kind of introducing everybody to the fact that baby food can look different for all babies and for different families. So some families might make purees homemade. Some might buy them from the store, and some might use what's called baby-led weaning, which is what we would see here in this picture, where they give the baby or young child like whole foods that they can explore and kind of eat as they're able to. Um, but then, for in terms of food safety, making sure that the food items are washed, the skins, cores, seeds, and peels are removed so that they don't choke. For fruits and vegetables, you can steam them or boil them. You don't have to with all fruits, though. Um, for meat, you can cook them, however. And then if you want to puree them, you can. You don't necessarily have to, depending on the type of feeding that you're doing. But of course, it all needs to be safe for the baby. And then refrigerating leftovers for about 48 hours. And that kind of depends on how much it was messed with. Like if the baby had their hands all in it, you just might want to get rid of it. So, in terms of other fluids besides breast milk or formula, a common question is when to give these other fluids. So, water is not needed in the first 6 months of life. So, infants only need human milk or formula. They don't need additional water for the first 6 months of life. Around 6 months, you can start giving water. You could start giving some juice, like especially if constipation is a problem, some juice might help. Um, One important thing here that you might get questions about are plant-based milk beverages. Um, so if it's a plant-based formula, that's okay, but like a soy formula, for example, that's fine. Um, but it's definitely not okay to give almond milk or coconut milk or something like that to an infant or young child and expect that that is going to be nutritionally adequate for them. Um, so if they are 12 months and under, they need to be having breast milk or formula. After 12 months, whole milk is okay, but giving them almond milk or something like that, it's, I guess, depending on their nutritional needs. Like if they're allergic to cow's milk, they could give them that, but making sure that they're getting complementary foods, but it's not needed before 12 months. And then in terms of food allergies, so the most common ones are milk, soy, egg, fish, crustaceans, shellfish, wheat, tree nuts, and peanuts. Cow's milk protein allergy is the most common allergy reported in infancy, with as many as 5 to 10% of infants presenting with symptoms suggestive of the allergy. Now, I will tell you that I really think that sometimes babies have GERD or gastroesophageal reflux disease, which I'll talk about here in a minute. Um, but sometimes I think that they have GERD and it's mistaken as a cow's milk protein allergy. So I try to work with families on that because I don't want there to be a mom eliminating dairy from her diet when she really doesn't need to. Now, sometimes cow's milk can cause GERD, so something that we have to work through. Um, so diarrhea and vomiting are the most common symptoms, but milk allergies can also present with dermatologic reactions like eczema, respiratory, and possibly systemic reactions, such as anaphylactic shock, but that is rare. Most infants outgrow cow's milk protein allergy as they go through the toddler years. I get a lot of questions about infant poop. So the color and consistency of the infant stools depends on the infant's diet. So if they're exclusively breastfed, then it's typically like yellow seedy color, but it could be green, it could be mucusy, it could be all different colors, but as long as there's not blood in it, it's usually okay. If they're formula fed, they tend to have more brown stools. Normal colors are green, yellow, and brown. Constipation in infancy is defined as significant spacing between bowel movements and dry, hard, or painful bowel movements. Diarrhea in infancy is defined as sudden onset of increased stool frequency, volume, and water content, and greater than 3 stools in a 24-hour period. So, really, when there's a sudden change in their stooling and it's more watery. So this is something to talk about because, you know, it might be that you're the one that's with the infant more than the parents are. And so, looking for these cues of these gastrointestinal issues are important because you might be alerting the parent of an issue. So, all infants spit up, or most infants spit up. And this is called reflux. So, when infants spit up, that is called reflux. Now, this can be managed by some things like feeding upright, holding the baby upright after feeding for a little while, not overfeeding, things like that. Um, so this baby here in the picture looks like he or she has some reflux. But this baby isn't screaming, doesn't look super excited or anything, but this baby isn't screaming, doesn't look like he or she is in pain. Um, Now, if you have a baby that is spitting up, whether you see it or not, they might not actually have it come out of their mouth, but maybe it's like a wet burp where it just goes up their throat a little bit. And they're really fussy all day long, screaming a lot. And they just, like your instinct tells you that they are in pain. That is called gastroesophageal reflux disease. Some people call it colic, um, but really that's when the baby is really in pain. And that's when like the baby might need medicine to help manage that. Infants who are experiencing pain or discomfort with eating, they might refuse feedings. Um, so you have to kind of figure out why they're uncomfortable and then kind of go from there. Okay, so in summary, infant nutrition, it's complicated. It's very individualized. Um, Breastfeeding provides the optimal nutrition. When that's not available, um, then milk from other lactating mothers could be used as long as it's screened and all of that. Um, and then also infant formula can also be used. And then complementary feeding should start around 6 months of age. So that is all I have for you. So, does anybody have any questions for me? I
I'm
think you're
sorry, I don't see any in the chat, but as always, please feel free to unmute yourself and to ask whatever questions that you have at this time.
Well, it's fine if there are no questions. Y'all feel free to reach out to me and ask me anything if you think of some, okay?
Will do. And at this time, then, I would like to take a moment and recognize Caroline Hunley. This is her last learning burst with us, and tomorrow is her last day with us. So Caroline, would you like to say anything?
Hey, sure. Can you hear me?
Yes.
Okay. Hey, everyone. I appreciate that. I had to go outside and listen because, wow, it's gorgeous out here. Thank you so much, Dr. Fogleman. That was super helpful. But yeah, tomorrow is my last day. So just saying goodbye to everyone. And you're in good hands with Sharonda. She's going to be our interim project director. So, yeah, my last day is tomorrow. So thanks, everyone, for showing up for this series and helping our children and families be the healthiest they can be. We appreciate you.
Thank you, Caroline.
Thanks, everybody.
If that is all, then we are able to be dismissed. I always want to be a good steward of your time. We want to thank Caroline for everything that she has done over these past years with Farm to Early Care and Education. And what a way to go out talking about feeding your baby. So, because you get to be home with him now and take care of him. So that is just wonderful. We want to thank you, April, also for delivering such great messages last week and this week, because we have to remember that eating starts with birth. Well, it starts in utero with our mommies, and then we have to continue the process as soon as they come out of the womb. And that's what Farm to Early Care and Education is all about: birth through age 6, making sure that we give them the right start at life with nutritional values. So with that being said, if there's no other comments or anything, make sure all your information is in the chat. Calliope is on it. She's going to make sure you have certificates, and we will have both slide decks from last week and this week for you when we do the wrap up of all of our learning bursts. Okay. Thank you, guys. Enjoy the rest of your summers. Get ready for fall, and we will see you again doing this next year. Affinity groups to start next month. Thank you.
Thanks, everybody. Thanks, Rhonda.
Thank
Thanks,
you.
April.